Welcome to the 226th day of the Swasthya 365 Days project. Today we are going to see about the extent of cancer, symptoms and diagnosis of bladder cancer. About half of all bladder cancers are first found while the cancer is still found only in the inner layer of the bladder wall. They are non-invasive or in situ cancers. About 1 in 3 bladder cancer have spread into the deeper layers but are still only in the bladder. In most of the remaining cases, the cancer is spread to the nearby tissues or lymph nodes outside the bladder. Rarely, in about 4% of the cases, it has spread to the distant part of the body. Black patients are slightly more likely to have more advanced disease when they are diagnosed compared to the whites. What two different bladder cancer stages means? The American Joint Committee on Cancer (AJCC) created a method of staging cancer called the TNM system. It is just used to describe how far the disease has spread. It is based upon the following three key pieces of information: T tumor, N lymph nodes, and M metastasized. T for tumors. The measures for how a main tumor has grown throughout the bladder and whether it has spread to the nearby tissues. The N lymph nodes is a group of the cells that fight disease. N is used to describe whether the cancer has spread into the lymph nodes near the bladder. M metastasized. Doctors use to describe whether the disease has spread into the organs or lymph nodes that aren't near the bladder. This is called as infiltration 2. The doctor will assign a number or letter after T and M. The higher the number, the more the cancer has spread. Once they have determined your T and M stages, your doctor will use this information to give you an overall cancer stage. These ranges from 0 to Roman numeral 4. Here's what each stage means. Stage 0. The cancer has only grown in the center of your bladder. It hasn't spread into the tissues or muscle of your bladder wall itself. It hasn't spread to your lymph nodes and other organs either. Stage 1. The cancer has grown through the inner lining of the bladder, but the muscle of the bladder wall, but not the muscle of the bladder wall. Nor it has spread to your lymph nodes or distant organs. Stage 2. The cancer is grown throughout the connective tissue in your bladder and to the muscle layer of the bladder. Stage 3. Cancer is now a layer of fatty tissues that surrounds your bladder. It may also be in your prostate, uterus and the vagina, but it hasn't spread to the nearby lymph nodes or to the distant organs. Stage 4. This may include any of the following. The cancer has spread from your bladder to the pelvic or the abdominal wall, but hasn't spread to the lymph nodes or distant organs. The cancer has spread to the nearby lymph nodes, but it didn't reach the distant organs. Cancer is now in your lymph nodes or distant like your bones, liver or lungs. Now we are going to see about the symptoms of a cancer. The most common and often the first symptom is blood in your urine. It may be just a little or it is be enough to change the color of the urine. It may turn orange, pink or darker red. Your doctor or lab tech will only detect the urine test. Make an appointment if you have any of these symptoms. You have to urinate more than usual. Your urine changes color. It hurts or burns when you pass urine. You feel you have to urinate if your bladder is not full. You can't urinate, you pass very little. Once bladder cancer starts to spread, you may notice you can't pass urine when you feel like you have to. Your lower back hurts. You're losing weight without trying. You are not hungry as usual. You have swollen feet. Your bones hurt. You often feel extremely tired or weak. Now we come to the diagnosis of bladder cancer. First of all, the doctor probably will do a complete medical history. They'll ask you about your overall health as well as anything that is increasing your risk, like a family member who had a bladder cancer. Next, they'll probably do a physical examination. This may include a pelvic examination for women and digital rectal examination, often abbreviated as DRE. In this procedure, the doctor will put on a glove and insert the finger in your rectum. This will allow them to feel the tumor in the bladder. It is also give to them an idea of how the bladder is big and whether it has spread. If a doctor finds something is not normal, they order the lab test. They might also send you to see a urologist. That's a doctor who focuses on the disease affecting the urinary system, kidneys, bladder, etc. and the male reproductive system. A urologist may run the following test to get a better idea of what's going on. First, he'll go out to an urine test. When you pee in a cup at your doctor's office, the number of things they or other health professionals can look for. Your urine analysis. Your doctor will check to see if there's any blood or other substances in your urine. Urine cytology. Your doctor will see a microscope to check whether the cancer cells in your urine. Urine culture. Doctor will send your urine to your lab. After a few days, lab technician will check whether the kinds of germs grew on it. These results will tell your doctor to have a bladder infection. Your urine tumor markers test. These look substances that are released from bladder cancer cells. The doctor can use one or more of these along your cytology to see whether if your disease. Cytoscopy. Your doctor will place a stethoscope, which is a thin tube or light video camera on the end of the opening of urethra. The duct you urinate through and into the bladder, allowing to see the inner wall of the bladder using the camera. Transurethral resection of bladder tumor, often abbreviated as TURBT. If a doctor finds something that doesn't look right during a cystoscopy, then they take a sample biopsy to see whether it's a cancer test. Imaging test. They use X-rays, magnetic fields, sound waves, radioactive substances to create pictures what's happening inside your body. Here is just of the few imaging tests that your doctor can do. Intravenous pyelogram, IVP. There's an X-ray of your urinary system. The doctor will inject a dye into your vein. It will highlight the tumors in your urinary tract. Retrograde pyelogram. Your doctor will insert a tube or catheter into your urethra and the bladder. They inject dye through the catheter so that they can see the lining of the bladder. If there are any tumors in urinary tract, they'll show up there. You can do a CT scan. The doctor can image of your kidney, bladder, and ureters. It will show tumors in your urinary tract. It can show lymph nodes that contain cancer. MRI, a magnetic resonance imaging. The test is used to radio waves and sound magnets to get images of the normal urinary tract. Ultrasound. Sound waves create pictures of urinary tract. It allows the doctor to see how whether the bladder tumor is. Chest X-ray. In a cancer, your bladder spread to your lungs. This test will allow the doctor to see it. Bone scan. The cancer has spread from your bladder to your bones will be visible to this scan. Thank you.